So here are 9 exercises for core stability training in the treatment of low back pain. All of them are building off the first one, so make sure to stay to the end and watch as you progress, adding that first movement into the other exercises. So first we just have the TA or transverse abdominis contraction. You're going to find your hip bones on the sides, and then you're going to kind of roll your fingers in, so you're feeling into that abdominal wall, and then the goal is to pull your belly button towards your spine. So kind of like you're sucking in to tighten that TA, but you still want to breathe. So you're not holding your breath. So you're going to pull the stomach in, hold it for 10 seconds. So now we're going to build on that. So you're going to pull that stomach in again, starting with your legs in this hook lying position, and you're just going to march one leg at a time, just to about 90 degrees or perpendicular to the ceiling. Trying to keep this tight, the TA or your core tight the whole time, still breathing, slow and controlled, just like that. So the goal is to try and keep that tight and the back flat. You don't want your back arching up, you don't want to be rocking. This is going to stay still and contracted. The legs are the only thing moving. Now you can do a similar variation of that last one. You're going to pull the stomach in again, and then you're going to let one leg fall out to the side, come back, out to the other side, and come back. Keeping the core tight the whole time, the hips and the core stay stable. I don't want the rocking side to side. This should not move. It just stays tight, core pulled, stomach pulled in, and then going side to side. So now we're going to progress to a dead bug once you have a little more core stability and a little less of the back pain. So arms and legs up, pull stomach in to tighten the core, and then alternating opposite arm and leg extending. So the goal is to keep that stomach tight and pulled in, still breathing, and really not letting that back arch up. It should stay pretty stable and pretty flat. Just like that. Now adding a little bit of hamstring and glute strengthening, because the hip muscles and the core muscles go together and kind of overlap. So they're very intertwined, so it's important to do a little bit of both. So pulling the stomach in again, we're going to do a bridge. So feet about shoulder width apart, stomach pulled in, lifting the hips up, hold it for a second, come back down. Trying to keep the core tight, nice and slow and controlled. So on your hands and knees, still working on that, pulling the core tight, and you're going to alternate opposite arm and leg. So kind of like the opposite of the dead bugs. And you're trying to keep this back pretty flat, pretty stable. You're not rocking and moving your hips a ton. It's pretty much pull that stomach in and then just slowly extending the arm and leg, staying nice and still. Next we're going to do a plank. I'm going to go on my elbows. You can do this on your knees if you need to, if it's a regular plank is too hard. But then I'm going to go up, lift my knees up, trying to keep the pelvis tucked, pulling the stomach in like we were talking about, that TA contraction, holding it, trying to maintain that position throughout the plank. You don't want to be too low where you got a big arch in the back, or too high. I'm going to try to be nice straight line, keeping the core tight and the pelvis kind of tucked in. Last one, we're going to do a side plank. So a lot of people tend to focus on their core, like their rectus abdominis, those normal abs you think about, but a lot of people avoid rotation or kind of lateral flexion, so with the side. So a plank, side plank is going to help with that. So we're going to, you can also do this one on the knee if you need to make it easier, but we're going to keep the leg straight, try and keep the body in a nice straight lane, so I'm not in like a L shaped, nice and straight, lift up, hand on the hip, pulling the stomach in, keeping that tight. An extra that I want to add, which is more of a hip exercise, but the core and the hip go so close, are so closely related. These hip abductors actually help with your stability when you're walking or running or standing. So if they're weak, that can cause some of that stress to translate into the low back. So nice and straight line again, and then you're going to tighten the core, and then you're lifting that leg up toward the ceiling, keeping the toes pointed forward. So you should feel it right here, nice and slow and controlled, keeping it in a nice straight line. Thanks for watching. Please like and subscribe to support the channel. I would really appreciate it.